Do you have a cervical disc bulge and you're trying to find a way to avoid surgery? You've had the MRIs, the neurosurgeon says you need surgery, but you're just not quite convinced it's bad enough yet, and you're holding out hope that you don't have to go over the knife. You've tried massage, you've done physical therapy and rehab, you've tried rest, but it just doesn't seem to be going away all the way. In our office, we do a procedure called upper cervical chiropractic, which focuses on the top two vertebrae in the neck. And in a second, I'm going to get to relate to you how getting this upper neck area moving the way it's supposed to be and free of the cord can help the body function better, and in many cases help people avoid surgery. We've probably had several hundred people. I haven't kept stats because we're too busy helping people, but we've had several hundred people over the years avoid cervical disc surgery. Here's how. When you have a cervical spine disc and it's big enough to be effacing or pushing on the spinal cord, usually they have radicular or shooting pain down the arm. If it's really bad, these people find comfort from putting their hand on top of their head. They call this Bacotti's sign, which takes the pressure off of the disc and gives them relief. But when you have a disc that's on the cord, segmentally, the muscles in the lower neck, most common is C5, 6, followed by 4, 5, 6, 7 cervical disc. Most usually the reason that is happening, when the upper neck dislodges, the head usually gets thrown forward. When that happens, the upper trapezius muscles engage and become tight. And once we pass 28 years old, the disc, the way they stay healthy is by movement. So when everything in the low spine is locked down and you lose motion in the lower cervical spinal segments, there's a process called desiccation. The disc literally dries out. And then what starts to happen is it starts to lose height and it becomes more susceptible to injury, and it's more susceptible to disc bulge. So when those muscles are locked down, are able to be relaxed and you regain motion, and the structure that's forward like this starts to come back, get the head back up on top of the neck. Many times these cases that are surgical can avoid surgery, and then long term, if they stay under care and keep things the way they're supposed to, they can long term avoid surgery. So the work that we do in the office is called upper cervical chiropractic. It focuses on the top two vertebrae in the neck and their relationship to the cord. Many of these people, like I said, have lower disc issues. It started from a trauma 10, 20, 30, 50 years ago, which set the imbalance and process in the body and weakened the lower spinal segments, and the disc starts to dry out and desiccate, and then they lift something heavier, they're at the gym and the disc bulges and boom, they've got a problem. So reversing all of that, we take 3D imaging of the upper neck to find out exactly how the vertebrae's off, to get it back in its normal range of motion. Keeping it there allows the structure to return, and in many cases, people to avoid cervical disc surgery. So we're located in Sarasota, Florida. We do offer free consultation. If you're outside the Sarasota, Florida area, there's a website you can go to, www.uccnearme.com. There's doctors throughout the world that are housed on there, and we have one goal, and that's to get this message out to the world, to people who are suffering and looking for natural alternatives to recover their health.